What are the negative effects of a knee replacement surgery? Negative effects of a knee replacement surgery can be broken down into two categories. One, perioperative. It means it happens around the time of surgery, within first 1 month of a surgery. And second, which happen after 1 month of the surgery. We'll first talk about the negative things that can happen 1 month after the knee surgery. So the most common thing that can happen is no relief from the pain or partial relief from the pain. Normally, more than 90% of the patients after knee replacement surgery experience extreme relief from the pain. However, there is a very small group of patients who may still feel some pain in the knee joint, especially while bending the knee, maybe years after the knee replacement surgery. And the most common reason is for that is the poor surgical technique. If a proper surgical technique is used, then 98% of the knee replacement patients never feel pain in their knees again. And second thing, then the patients can feel after a long time of a knee replacement surgery is some kind of stiffness in the knee joint that can happen because the arthritis component, which is resulting in some tightness or stiffness in the knee joint. However, if patients maintain good body weight, exercise regularly, have a good nutritious life, then they normally do not feel any kind of stiffness in the knee joint after knee replacement surgery. Now coming to the category of perioperative negative things. So all the patients who undergo a knee replacement surgery have three kinds of risks majorly. The first risk is the infection. Because you're making a cut on the skin, there's a chance that you may end up having an infection in the knee joint, which is a very bad thing. If it happens, you may end up having very long stays in the hospital, spending so much money, getting repeated surgeries, and maybe never be able to walk again properly. However, with the use of proper sterilization techniques, and that's why we always stress upon the right surgeon at the right hospital and the right patient who has a good immunity, is not immunocompromised for any reason, to decrease the chances of infection to less than 1 in a million. That means we take all the precautions so that you do not end up with infection in the knee joint. The second problem is the blood loss. Whenever we do surgery, we normally stop blood flow to that part of the body. However, certain patients do experience excess loss of blood from the joint as a part of the surgery. In such patients, we transfuse blood to maintain it at a good level, and normally patients do not have any long-term complications because of this. And finally, a dreaded complication that can happen to about 1 in 10 lakhs of knee replacement surgery patients is DVT. That is collection of blood clots in the veins of the legs. And these clots can travel up to the heart or lungs or brain and can cause serious problems including death. However, when we use proper surgical techniques, proper anesthesia techniques, choose the patient correctly, use the right surgical technique, then the chance of this blood clot formation, DVT happening, is less than 1 in 10 million of the patients. And furthermore, to protect you from this complication, we give you some medicines which are blood thinners and also try to make you walkable as soon as possible after the surgery, so that the blood is not stagnant in your legs and you start walking, your blood is flowing continuously, it's not stagnant and no clots are formed. So overall, very little patients, less than 1 in a million patient, can have the complications or negative effects with the knee replacement surgery. However, this can be further brought down if we choose the right patients. It is done by the right surgeon at the right hospital.